how much of your practice do you see? I mean, does obesity play a role in what you're seeing as far as
Oh yeah,
musculoskeletal pathology, or a large percentage of your
for sure.
patients tend to be on the obese side, or how does that look?
It's also a very hard conversation to have with them because they're asking why their back and their knees hurt. It's like, well, you're 300 pounds. So that might play a role in it somewhat. But the fellow I mentioned before he was diabetic, he had, he had done it for weight loss purposes. And that's kind of what he started on the journey for, is to lose weight. But I try to encourage him as far as like what our goals should be as far as us getting healthy first, and then the weight kind of falls off. So getting healthy is the first thing we should, losing that extra fat around our organs, getting our A1C down. Like that's kind of where we want to start at. That's the good first goal to have. And then the weight kind of follows after that.
Like, I know when I was operating on obese people, it was just harder. I mean, it was just technically harder to, you're when you do an incision, it's harder to see what you're doing because there's so much excess adipose tissue in the way, and it was just harder to visualize things. You had to have these special retractors brought in. I mean, is it harder to manipulate people when they're very big?
Yeah, for sure. Especially if someone, if they've got a lot of extra fat around their glutes, it's like a lot of the work you do is on the SI joints. So it's kind of hard to find out where exactly you're contacting a lot of times. You get better at it, but I thought that was kind of a difficult thing to overcome at first, just because everyone I worked on in school, everyone's very fit, very healthy, so you don't run into that, like actual real world situations until you're either in your preceptorship or you're adjusting people in the real world. So yeah, definitely tougher. You're more limited in what you can do.
Yeah, one of the things, and maybe it's just my perception because I always ran into the athletes, but it seems like, and correct me if I'm wrong, but many people in chiropractic school tend to like physical fitness. They tend to be physically fit. Is that a fair
yes,
assessment?
Very much so. I mean, there was probably only, I would say, 10% of my class that I graduated with was like not healthy. Like you look at them and they're overweight or anything like that. Or maybe like 10%.
Yeah. I mean,
so it's very disproportionate.
Most people are going to be in their 20s, I would imagine, so they're still relatively young. But I would say it's fair to say in medical school, you have a significant percentage of the medical incoming students now that are unhealthy and often dealing with obesity. And it's just kind of, we've gotten this. It's kind of unfortunate that we have so many people in there, and we've got physicians now that are just promoting obesity. They're like the fat acceptance doctor, and it's just like, don't weigh me. It's not important. It's not a risk factor, which is complete nonsense in my view. But we're seeing quite a bit of that. Do you guys have? I know when I was a physician, we had a lot of people from the pharmaceutical companies dropping by to drop off treats for the office staff or bring us lunch, or it was always kind of, pizza and donuts and whatever. I made them actually remember one time I said, hey, bring me barbecue, bring me meat. I actually did that, which is kind of nice. So as I got later in there, I was like, just bring a bunch of, Rudy's barbecue. I remember we would get a bunch of brisket and stuff like that. But does that infiltrate the chiropractic? I'm sure you've got beds and manipulation tools. Is there an industry part of that where they do that as well?
Well, for sure. I see a lot of Amish patients too. They're rather unhealthy as a community, just in what they eat.
Really? What are they eating? Because most of us think, well, the Amish, there's no electricity, they're horse and buggy, they're doing manual labor. What are they eating?
Well, and I think that saves them a lot of times, but you can tell a lot just based on the manual labor is what saves them, is what I'm saying. But a lot of them, they don't have good dental hygiene. Like they have a very carbohydrate rich diet. I mean, a lot of sweets too. That if you go to any Amish store, like most of them have bulk sweets and bulk treats, and they usually bring those to us. So I take them, and you don't want to be a douche and like, oh, I don't eat that. So I just say thank you, and I put it to the side. A lot of times they'll eat. They do eat a lot of meat, So that's good. And they usually have their own chickens, so they're eating a lot of eggs. Unfortunately, they add in all the extra crap too. So lots of sugar, lots of pies, cakes, sweet treats, and you name it. So a lot of times that's a problem that we'll run into with the Amish is that they just they kind of eat themselves into a lot of problems.
But everybody does. I mean, everybody's eating themselves into like I said, we're all digging our graves with our forks, kind of type of thing. Exactly. And what as far as do you foresee any significant changes in the way you practice now that you've discovered that nutrition has probably a more important role than maybe you thought before? How do you foresee? I mean, are you looking at maybe trying to facilitate this a little more?
Yeah, most definitely. I mean, I'd love to be at the point, as you probably have maybe 25 good years of practicing where you can you can really give it your all, and you can give the patient a really good adjustment before you start wearing down. Now that's the stereotypical average Joe chiropractor. That's not a carnivore chiropractor. So maybe I could be the exception to the rule, but a lot of times they have a lot of arthritis in their hands as they're older. So they want to transition more into consultation, supplementation, ancillary sale of products in your practice rather than adjusting. I don't necessarily want to I really don't even hardly sell any supplements anymore because, the supplement companies kind of pissed me off. But that was one of your questions too. That was it. It was the pharmaceutical companies drop off stuff. The supplement companies do that as well. So it's kind of like a mirror image almost of how the pharmaceutical companies behave. There's big money in those supplements, as far as them, trying to influence which supplement you're going to sell. So they oftentimes will bring a rep in, and we'll get talked to, similar to probably how they do it in pharmaceutical industry.
Yeah, and I think I feel for people that try to do functional medicine or anything, because,
right.
As a physician, you're put in, as an allopathic physician, you're put in this system, which is, I mean, that pathway is set in stone. You're going to be doing procedures, you're going to be prescribing pills, and everything, all the electronic medical record, everything is geared for you to do that. And if you try to step outside of the system, not only do you become less efficient, you don't get paid as much and you lose income. And so it's disincentivizing, it's because you train for however many years. I mean, I went to school for 13 years to do orthopedics. I mean, it was just 4 years of medical school, 4 years of college, and 5 years of residency. So you're kind of sucked into that. You're like, okay, I'm going to stay in that system, and to step outside of that, it's like it's financially very, very challenging,
right,
and so it's easy to get into the supplement trap or get into the lab, draw a bunch of labs, and is that something do you guys deal with labs much? Are you doing lab work as much?
The fellow I work with, he deals more in blood work and lab. I'd like to get in that eventually. I talked to a fellow, he was an older chiropractor, and he's like, in the first 3 to 5 years, he's like, just focus on adjusting, get good at adjusting, and then start to focus on, blood work, management of other conditions outside of stuff that you can deal with chiropractically. So yeah, I think eventually I'll get into the blood work side of things. I share a lot of the same sentiments with you. It's like, what do we really know about blood work? It's just a snapshot in time. Like you said before, my wife, we went to a functional doctor, or he was like holistic medicine guy. It was like $3,000 before he did any analyzation. Yeah. It was all like, the stool sample testing, blood testing, every freaking test in the book. And he was like, I don't know. So that kind of pissed me off.
I see some of
that kind of formed my opinion on some of that stuff.
I do see some of that functional medicine stuff, and they'll literally, it's like you said, $3,000 a labs before they even see you.